Hello, Mr. Smith. My name is Lydia Savage. I'm the speech language pathologist that's going to be working with your medical team to guide you and safely transition you after your total laryngectomy. I understand that this can be very overwhelming. So much new information and new changes are coming your way, but I am here to guide you through all of it. I would like to kind of help you understand what that looks like is that what will happen is your whole larynx will be removed, which is what we call the voice box. Therefore, that means that voice naturally will not be produced ever again because you will not have the vocal folds. And your breathing will be occurring through a permanent stoma that will be placed in the neck. Changes in communication. Again, natural voice will be lost after surgery, but that does not mean that you cannot communicate. I, as an SLP, will help establish a new method of what we can use for you and what works best for you in order to communicate after surgery. There is many options. First, after surgery, we will be using whiteboards to just double check on pain and medication intake and so on. Once healing process starts, there is few different ways. That the most natural way, let's put it, the most natural voice sounding like will be the tracheoesophageal speech. This is a tube that is placed between the trachea and the esophagus. It's a prosthesis. And most people enjoy that as it will be the closest to what a natural sound would sound like. If you don't want to do anything invasive that goes into your body anymore, a really easy device that can be used is the electrolarynx. It is a handheld device, really easy to use, and it has to be placed on what's called the sweet spot, and then it creates sounds after vibrations, as your mouth still knows how to move to produce the sounds, even though the vocal folds and the larynx will no longer be there. The third option is esophageal speech, and this will be a way that you will have to learn how to inject air into the esophagus and to expel it and to release it to be able to create sounds. I know all this sounds too complicated, but once we get there, I promise you that things are gonna start falling into place. And of course, the beginning temporary AAC devices, we can use the phones or anything you need to get you started. Another thing that is going to change is swallowing. The airway and the food canals or the esophagus will be separated. So the positive thing about this is that there is no aspiration after the surgery, no or minimal, because those two different pathways are separated. And some patients may experience food sticking or narrowing or a little bit of scar tissue after surgery. What are the strategies that we can use to have a successful and better quality of life after total laryngectomy? We need to make sure that we take care of our stoma, and so no infections will happen. Heat and moisture exchanger should be used. It is recommended as your throat and your oral cavity will tend to get more dry. It is important to stay hydrated, but again, we will have all those follow-up appointments and we will keep reminding you until everything falls into a routine. Also, it is important to educate your wife and your closest family that you will need extra time for communication and to learn all the basic stoma cares and maybe to be there for the appointments. Resources that you can use are our ASHA portal, which is our American Speech Language Hearing Association, and International Association of Laryngectomies. So if you have any questions at all, I'm always here for you. Reach out at any time. Thank you, and let's do this.